Good afternoon, guys.
Good afternoon, sir. Welcome.
Thank you.
Hi, JP.
Hey, how are you? Good afternoon.
So for everyone that's on the call, we're going to start in about 35, 40 seconds. So I'd like for you to go ahead and mute out if you could. And we're going to go ahead and start, like I said, in about 30 seconds or so. Well, good afternoon. My name is Bobby Spiegel, and I am the President, CEO for the Corona Chamber of Commerce. And we're honored to be able to co-host this event today with our partners, of course, the City of Corona, and some other partners as well that Jessica will be introducing in a few moments. Today's program, COVID-19 Workplace Safety for Manufacturers, Best Practices and Guidance for Protecting Your Workforce. As the president and CEO of the Chamber, it's a number of years, almost 20 years now that I've been in this position. And I know that most every business is looking to protect their employees. We're on unprecedented times now with a pandemic. And I know that the business community is looking for ideas and best practices. So when Jessica brought this to us and said, hey, how about partnering? We jumped on it because this is exactly what our business community needs. And we're so grateful that each and every one of you are part of this presentation. You will be receiving a link right after this session is over with that will play back the video so you can keep that for reference. And it's a great opportunity there. This type of a program is just one of the many benefits that we offer you as being part of the Chamber and the business community. Our slide that's going to go up next is about our membership development specialist, Robert Yanez. If by chance you're not a member yet or you have questions on how to expand your membership platform, please contact Robert. His information is right there on the slide. One of the seminars that we do with the City of Corona is a Coffee with an Entrepreneur. And this is done every month, and it is on the second Monday of each month. On February 8th, we have an inspiring young man. He's 18 years old, and he is amazing with what he's done. Corona has the rich history of being the lemon capital of the world, and we are so blessed that many of our business people do what we do here at the Chamber. We make lemonade out of lemons. Elijah Stacy, along with his siblings, were struck with this horrible disease, which is a muscular disorder. He's taken those lemons and he's making lemonade out of it. Inspiring story. Yes, only 18 years old, but a lot of wisdom, and a lot of great information. Again, this will be a program that is co-sponsored by the City of Corona and the Corona Chamber. This next slide is a special training that we encourage all of you to participate in. If you register before February 17th, the slide is incorrect, and we'll get the corrected information to all of you. But I did want to talk to you about a special training that we've got with a special coaching with Paul Webb at the first part of February. If you're at all interested, please reach out to us and let us know. The next slide is on our doing business in the region for February 3rd. We definitely want you to plug into that. We had that this morning, and every Wednesday we have these Corona Chamber business briefings. It is about 35 to 45 minutes long, and some great breaking information, advocacy outreach, and information. And speaking of advocacy, our last slide before I bring Jessica on is about our labor law posters. And these posters are available now. It is a partnership that we have developed through a lot of the different businesses that made some tremendous contributions this last year that we're able to give every one of our members a free poster. And then we've also got reduced pricing for members as well. So we encourage you to secure those. Those posters are absolutely necessary if You have people working remotely. They each need to have one. We have them so you can mail them off in an envelope. It's very convenient. Special pricing for members after the free one is $30 each, 4 posters for $100 or 10 posters for $200. And you can pick them up at our chamber offices, or you can call us and we can go ahead and get those shipped off to you via mail. So at this time, it gives me a great deal of pleasure to actually introduce the partner in business development. Our partner is the City of Corona, and Jessica Gonzales has just been a tremendous asset for the City of Corona as well as the Corona Chamber. Jessica comes to us from the Orange County area. She's got years of knowledge and experience. However, her connections far exceed the number of years she's been involved in the industry. She constantly is thinking of how can we make it better for our business community. We are so pleased to have her as a business partner and to welcome her here today for the rest of the program. Ladies and gentlemen, Economic Development Director for the City of Corona, Jessica Gonzales.
Thank you, Bobby, and thank you so much for hosting today's webinar, and special thank you to our presenters for bringing this timely information and resources to our participants here this afternoon. So today I want to share with you some of the upcoming ways that we are here to support you. And so in terms of economic recovery and business resiliency, what is on the horizon, and very specific here to our manufacturing community and also to those that are seeking to start business ventures. And so very representative of the webinar today, we are partnering with various entities at the regional, state level so that we can bring you these resources. So today's webinar, Workplace Safety, is part of our Corona Manufacturing Assistance Program. This is a new program here in the city in partnership with the Chamber of Commerce, with CMTC, with the Governor's Office, Riverside County Community Colleges launch, and County Workforce Development. So it takes a village, all of these partners, to be able to bring you these resources. So throughout the year, you will see first and foremost that we will be sending out a needs assessment survey to gauge the needs of our manufacturers to be responsive. We also will have webinars such as today's, roundtable conversations, visitations, virtual at first, and then in person when time permits, and apprenticeships opportunities to connect our job seekers, our workforce, with the great opportunities at our manufacturing companies. Stay tuned for that survey and certainly more events throughout the year. Also on the entrepreneurship front, we want to continue building capacity here amongst our population of over 170,000 residents and over 12,000 businesses. So entrepreneurship academies are underway in English and Spanish. We are launching for the first time a Spanish Entrepreneurship Academy that starts on February 9th. We are pleased to offer this 8-week academy. Response has been great for this academy that we are now planning a second cohort. We've already filled up the first one, so that is fantastic news. So stay tuned for more information on those two efforts. Our next slide, please. So just want to make sure, as Bobby shared, that you understand the format for today. We do invite you to post questions through the chat feature, but please indicate the presenter's name, who the question is directed to, and Linda from the Chamber will help us at the end to facilitate those questions. And a recording, as Bobby mentioned as well, will be sent to all the participants that are here with us today. Next slide. Excellent. Now, as you can see here on the screen, we have brought you the best in terms of industry experts, resources that can share with you timely information. How do you adapt? How do you plan? How do you respond effectively to new regulations in the face of COVID-19? How do you protect your workforce? And what resources are at your disposal? So we have today Carmen Cisneros, Dan Liner from Cal OSHA. We also have Elliot Drack with CMTC and Traylon Bradley with the Governor's Office of Business and Economic Development. They will elaborate on their background during their presentations, but thank you in advance, and I'm sure you will find today's content to be worthwhile. Thank you, Linda. Okay, next slide. So to start us off, I'd like to turn it over to Elliot from CMTC to guide us through his presentation. And Elliot, the floor is yours if you'd like to commence screen sharing.
Okay, thank you very much. I hope you can all see my screen. And thank you for the opportunity to be here today and to present this information to you. I hope you find it valuable and worthwhile. And let's jump into it. First of all, our legal disclaimer. Note that the material in our webinar is for informational purposes only. It should not be considered legal or other professional advice. CMTC advises you to consult an appropriate professional to determine the best solution for your individual and unique needs. Again, my name is Elliot Dratch, and I'm a safety and quality consultant. I work for CMTC, which stands for California Manufacturing Technology Consulting. And we are a professional consulting firm that specializes in manufacturing. We work only with manufacturers, typically helping them to improve their competitiveness and their profitability. We're also part of the NIST Manufacturing Extension Partnership, which is a national network of centers that receives some funding from the Department of Commerce to help improve the operations of small and medium-sized manufacturers throughout California. So let's start talking about the first part of this presentation, exposure and protection. Let's first be aware that when a person coughs or exhales, the droplets fall down to the ground due to their weight, but the aerosol can stay suspended in the air for several hours. And this is what we need to be concerned about. This is why we all have to wear face coverings now. So the face coverings reduce the projection of the cough and the exhaled air. So if everyone would follow this thought process, then we could dramatically reduce the rate of infection in society. We've also noted that the virus will only last for about a day on paper and cardboard, but up to several days on hard surfaces like countertops and switch plates. So the bottom line is that you should be as cautious as you can without making yourself crazy. So leaving your mail or packages to sit for a day is very easy to do, and it would pretty much eliminate any risk there. Think about it. In order to get the virus from a box, the delivery person would have to be infected and cough onto the cardboard. Then you'd have to touch it. Then you'd have to touch your mouth or eyes before you wash your hands. And so it's a pretty low risk. What's more likely is that you would touch a hard plastic surface within a few days of it being infected, something like a keyboard or a chair or a handrail at work, or a stapler or a coffee maker in the break room. Those are a bit more concerning. And so we have to gauge where we put our energy, right? Next is talking about the break rooms in our companies. Every company has a break room. Some are pretty, some are not so pretty, but the break room is a good place to create administrative procedures that force changes to your company's safety profile. And OSHA calls these procedures administrative controls. And they're meant to control the way your people actually work. So administrative controls are highly preferred over PPE. And that's because they create the conditions that prevent the risk from ever occurring, as opposed to just minimizing the harm. So in your break rooms, you want to determine the optimal number of seats that should be in there. You want to limit them. You want to place signs on tables and ensure that proper social distancing is being maintained. So an example of an administrative control would be removing the chairs with the red X's to make sure that the room can no longer accommodate a large group of people. Another example would be staggered breaks and staggered lunch times for your employees so that you minimize the number of people congregating at any one time. And you need to plan how to prevent a line of people forming to use the microwave oven. So you might add additional microwaves. So the break room is an area of concern. Now, this slide is to help you think about physical distancing throughout the company and where do problems occur. People should not form a line at the time clocks in your manufacturing plants in the morning or in the evening. If a line is forming, mark on the floor where employees are supposed to stand. Don't allow them to congregate. And here we've added red X's on every other person to indicate that those are the people that would have to leave the line in order to create enough physical distancing. So you should consider having your employees wait in their cars until the scheduled start time of their shifts. You should consider staggering the start time so people purposely avoid coming into face-to-face contact with each other. You should use disinfectant wipes on the time clock before the next employee touches it. You should create one directional walking paths through your halls and through your buildings. So you want to designate one specific door as the entrance and a different door as the exit. And you'll note on this photo, it was taken before the face covering mandate was put in place, but it still gets the point across really well. Okay, we need to consider the lockers and the bathrooms in manufacturing plants. So here's some suggestions for additional administrative controls to minimize face-to-face contact of your employees. As we said, stagger the start and the end times by adjusting your work schedules. And again, the goal here is to plan a way that we will eliminate people from coming into contact with each other for more minutes than they need to be. And that is because we're concerned about people that are asymptomatic. I hope you were able to hear me. Is there a problem with the audio at all?
There was some delay for some reason on my end. Could you go back just as far as just on this slide and touch on the last 30 to 40 seconds or so?
Sure. We were saying that it's important to adjust your start and end times by adjusting your work schedules. We want to prevent people from coming into face-to-face contact more than they absolutely need to be. And the main concern is people that are showing no symptoms, people that are asymptomatic. And I cited an article, a publication from last month by the CDC and the Journal of the American Medical Association that almost 60% of all coronavirus cases are coming from asymptomatic carriers. So we have no idea that the person is sick. They look fine, but they're sick. Is the audio still okay?
Yes.
Great, thank you. Okay, as of June 2020, it became mandatory for all employees to wear face coverings at work if they interact with others. And so this means wearing the face covering over your nose, not under your nose. And the face coverings can be either the simple cloth type or a surgical mask, but the nose and the mouth must be covered. And that's to prevent you from spreading your germs to others, and you might be asymptomatic. And that's what the big concern is. So very important, take those face coverings home and wash them. Always start the day with a fresh one. Keep a supply on hand, keep rotating them. And then there's one type of face covering that the health officials don't want you to use, and that's the N95 type mask. I'll have a picture of that. The N95 masks are reserved for medical workers and healthcare workers, and there's not enough to go around. And so we want to make sure that the frontline health workers have the right protective gear to keep them out of harm's way. People in manufacturing plants, generally speaking, operate in a very low risk environment. It's considered low risk of getting coronavirus, considering as differing with a person who works on the front line in the healthcare business. Okay, it's important to look at the traffic flow, the walking paths through your plants. And we should give some thought about where people enter and where they exit, right? We want them to enter and exit through different doors. And the goal is to reduce the face-to-face interactions. And so you should also be thinking about what happens when it rains. We're in California, but it still rains a few days every year. And when it does, things go haywire. So if you're going to have visitors in the plant, we want to make sure that we don't have our visitors piling up and all waiting, squeezed into the reception area at the same time. So we need to have a plan for that and think about how we're going to stagger all of these interactions. And then between the rooms, try and prop the doors open. If they're not the automatically closing fire doors, you can add the rectangular kick plates to your doors so that the employees don't have to use their hands to open them. Okay, so for PPE, number one, wear a face covering whenever you're in the vicinity of others. Whenever it's likely that you're going to come in contact with someone else, you must wear a face covering. And then add a face shield if you have to work in close quarters. So there might be some areas on your production line or in the assembly area where people have to work close together, less than 6 feet apart. And if that's the case, then make a flip down face shield mandatory, put it in their job description, train them on it, and make sure that they understand that that PPE is now a required part of their job. And then thinking about gloves, gloves can create a false sense of security. And some people might touch a contaminated surface because they feel they're protected from the virus because they're wearing gloves. But in reality, those gloves give people a sense of security that is not earned. And then properly removing those gloves takes some finesse. And so those contaminated gloves, if they're not removed properly, they could be exposing the employee to additional risk. So we're not in favor of gloves, but the bottom line, if an employee wants to wear gloves, they should be allowed to use them. They just still must always wash their hands after they remove the gloves. Some key safety actions. These are things that you should be teaching and preaching every day. Having your employees work together in teams or as part of the safety committee might be a good approach because it'll help them feel ownership and responsibility for looking after their fellow employees. So physical distancing is a key principle, but using physical barriers to actually block the flow of aerosol between people makes that concept even stronger. So notice the clear plexiglass partition between these employees. They had to wrap tape around the edges so you could see it a little better. And this is an excellent example of an engineering control. It's a barrier that physically prevents the virus from reaching the other employee. And engineering controls create physical barriers between the employee and the hazard. And so here's a couple of good examples: the physical distance between the employees and the plexiglass engineering control. For the next key action, you need a cleaning and disinfecting plan. And you have to realize that many cleaning products are labeled that before they will disinfect, you have to first clean the surface. So pay attention to that. You might have chemicals or cleaners in your plant that it might require a two-step process: first cleaning, then disinfecting. LA County recommends enhanced cleaning during this pandemic, and the enhancement means increased the cleaning frequency and disinfecting all of the high-touch surfaces at least daily. And so they direct you to go to the EPA website and make sure that the products you're using have been tested and are effective against COVID-19. And those are listed on the N list, N like Nancy. So all of those EPA chemicals that are effective against COVID-19 are on the N list. Or you can use a simple solution of Clorox bleach and water, typically a 10% bleach solution. You should just mix a new batch every day. And that's because the bleach loses its efficacy over time. So we recommend changing the bleach solution every day. And because aerosol can be suspended in the air for several hours, OSHA and the CDC recommend that you dramatically increase the airflow through the plant and the offices. You should consider using portable air cleaners and upgrading your company's air conditioning filters and increasing the airflow. So if you can set your ventilation fans to always be running, that's what they're recommending. Open your windows as much as possible. When you go in Costco and the grocery stores now, you can see they have their overhead fans running all the time. So the goal is to get as much fresh air into your plant as possible. And take a look at your air handling systems. You want to make sure that the air is blowing hard, the filters aren't clogged, they're being changed more frequently, maintenance is being done on schedule, and also pay attention to the design of the room itself. Oftentimes in manufacturing plants, in the shop, they've built, companies have built a conference room or a meeting room to have a quick meeting, and the room is not built to code. And that's a problem, because if it's not built to code, then it might not have the right air circulation in there. And during the pandemic, we're very concerned about stale air and coming into contact with other people's air. So make sure that the meeting rooms are all in properly designed rooms. And then communication. The last key action is to communicate the recommendations from the CDC and OSHA and the health departments. Frequently discuss the most important health issues with your employees. Ask them about, the headlines that are in the news. Make sure that employees have access to good information. This will keep everybody on the same page, and keep reinforcing the message that people with no symptoms at all are carriers the same way the people that are outwardly sick are carriers. And that's what we're trying to prevent. Let's take a look at some items in the plant, some other items. So OSHA has always recommended mitigating work hazards, starting with the best and most effective tool, an engineering control. As we were saying before, engineering controls are the most desirable because they create actual physical barriers to the virus. So examples of engineering controls would be placing physical barriers between the worker and the hazard, like those plexiglass screens that we saw earlier, or relocating a work cell to an area with better airflow. So that's the goal, right? The second best mitigation technique is administrative controls. And they're required if the engineering controls can't be implemented. A good example would be implementing procedures limiting the number of employees in the break room or in the locker area, or requiring employees to maintain at least 6 feet distance at the time clock. So those are administrative solutions. And the last line of defense is PPE. It's definitely important, but it should not be your preferred method to solve a work hazard. PPE offers protection, but it's always better to eliminate the hazard through engineering or administrative controls. Give a lot of thought to the layout of your workstations. For this woman, her materials are close by, so she doesn't need to walk to retrieve them. And therefore, they have eliminated her coming into contact with many other employees throughout the day. Having her materials dropped off at a designated spot eliminates the other workers from coming by and engaging her in face-to-face conversations. And the rollers on the track behind her allow her to slide the parts down and use momentum to move them to a downstream coworker. So again, doing things to eliminate the face-to-face conversations between workers. All the work areas where more than one person is working, they should be evaluated to maximize the distance between the employees. So notice the example of the workers here on the left not wearing face coverings or clear face shields, but the employees on the right, they're not wearing their PPE. This picture was taken before the face covering mandate. It's worthwhile to note that here in this picture, the employees are not working directly across from each other, which is a very good process, that you're changing the workflow, you're changing the sequence of the work, you're changing the configuration of the work area. Those are the things that we need to be doing. And then every plant typically has an air compressor or a couple of air compressors. Make sure that your maintenance employees are taking precautions when they're handling the air filters. They should carefully remove the filter, place it in a bag and dispose of it, not use pressurized air to blow the surface dirt off and then reuse it. Have a couple of slides on cleaning and disinfecting. So the County of LA, their guidance is to use enhanced cleaning methods, which means either a 10% bleach solution or the disinfectant. And you must clean any item that receives human contact by the end of the workday. That is specified. Okay, we talked about the N list already. I have a slide here for the recommended cleaning frequency. So this could really be your checklist. And this is to be used to make sure that you're going through all of the checkpoints every day, making sure that things are getting properly wiped down. So things like the shared tools and the work cells, the doors, the windows, the faucets, the work cell buttons, things that employees come in contact with. And then your factory supplies. So we know that factory supplies can be in short supply. So you want to keep a certain level of inventory on hand for these supplies. And you'll get a copy of this presentation so you can use this as a checklist. And then just winding up, I want you to know that CMTC is available to help. We provide assistance to California manufacturers. We're a nonprofit organization. Our mission is to help California manufacturers grow. We received funding through the CARES Act to help small and mid-sized manufacturers. And so this funding is being used to provide help from CMTC business stabilization consultants. So if you're a manufacturer in California, you can take advantage of a no-cost Zoom meeting where the business stabilization consultant understands your business's pain points. They do an assessment and they come up with a plan of action for your recovery and your growth. Many of our programs are no cost. Some do have a cost, but I encourage everyone to visit and sign up for a business stabilization consultant. Okay, and then just lastly, we're part of the Manufacturing Extension Partnership. We're part of NIST, the National Institute of Standards and Technology. We received some funding from the Department of Commerce, and this is our impact that we've had in 2019. Okay, so that's all I wanted to cover. I'd like to turn it over now to Carmen Cisneros and Dan Liner. They are going to be handling the OSHA part of the presentation. So I will disconnect and you can turn it over to them.
If Cal OSHA is speaking, we don't hear them.
Oh, I guess if it helps if I unmute, right? Could everybody see our presentation in slide mode, presentation mode?
Not in slide mode.
We're seeing just the regular screen.
Okay.
No, we have the screen and then the items on the left side.
Okay. Okay. Can we see it now or no?
Not yet.
Carmen, you might want to go to slideshow and then click on from the beginning. So slideshow right at the top.
That's where I'm going.
And there should be one that says start from the beginning.
Yeah, that's where I'm trying to go to, but I don't see it here, and I normally have it. View.
Can you click where it says slideshow at the very top?
Okay, I'm clicking. Okay.
Right there. And from beginning, correct.
Can we see it now?
Go back
Not yet.
to from the beginning.
Carmen, would you like me to pull it up on my computer?
Yes, please, because I'm clicking on it and I don't know why it's not working, and I'm trying the slideshow at the bottom as well, and for some reason it's not allowing me to do that. And I'm sorry about that.
It's all good, Carmen. That's our technology at best. So
There we go.
Okay, perfect. Thank you, Dan. Okay, Elliot, thank you very much. You presented a lot of very good information, and a lot of the information he presented, we're going to go ahead and present this information and how it relates to COVID-19 and the emergency temporary standard. I'm the area manager with the San Diego office, and Dan Liner is the area manager with our San Fernando Valley office. So here we have the disclaimer, and the disclaimer, this information is current as of December 28th, 2020. And as many of you know, this, COVID-19, the information, it keeps changing. We keep getting additional information. So we're trying to present as much as we can and as current as possible. But we do have a disclaimer where California employers do have the responsibility to be familiar with all regulations and to stay up to date with the regulatory changes and the adoption of any new regulations. I also want to let you know that this class is really a 3.5-hour class. We've condensed that 3.5 hour into 1 hour. So if you want additional information on some of the topics here, I highly suggest that you sign up for our webinars. We have 8 of them scheduled for the month of February and 8 in March. And they're free. There's no charge for these seminars, and we go further into a lot of these requirements, okay? So what we're looking at is on November 19, the Occupational Safety and Health Standards Board approved this new regulation, and it was adopted. It became effective November 30th of 2020, and it's due to expire October 2nd of 2021. We are getting many questions. Cal-OSHA consultation, and I do want to let you know that we're with consultation, not with the enforcement side of Cal-OSHA. And what we're doing since COVID started in March, we've been taking questions, and we're tracking the questions that we're getting. And now that the emergency temporary standard started, we're taking more questions because there's a lot of questions within the standard where clarification is needed. So we are submitting the questions to our higher ups, to our headquarters, and hoping that they respond to some of those questions, and they have. If you go to our website, and we'll have the link in a bit, we have a section for frequently asked questions. This passed on November 30th, and on January 8th, they updated some of these FAQs based on some of the questions where clarification was needed. But we still need some additional clarification on some of the other questions, okay? So what we have here for a COVID-19 prevention is a Title 8 regulation, which is 3205, okay? Cal-OSHA works with the Title 8 regulations. So with 3205, it's the COVID-19 prevention. And we're gonna go into the different sections. There's a 3205.1 that talks about multiple COVID-19 infections and outbreaks. And there's a 3205.2 that talks about major COVID-19 outbreaks. And we have a definition for that. And if the employers provided housing, there's a section as well under 3205.3, and that's very common in agriculture and construction. But at times in manufacturing, an employer may be providing housing. So there's some areas that you have to follow. Okay, and also we have a point 4 for employer provided transportation. Here on this website, we have links within the OSHA website of information that may be very helpful to you. The first one's the regulation. You click here and you go to the section and you're gonna find what OSHA is asking an employer to do, okay? We also have CPP is a COVID-19 prevention program. We have a sample program that that you could use. It's a template. You want to make sure, okay, and this I tell all employers, that you customize your program. Okay, you're in manufacturing. This information includes information. It's basically what the requirements are, but nobody knows your business better than you do. And that's why it's very important that you customize your program to your operations. Elliot gave us a lot of very good tips. Now take some of those and customize them. And then we also have a fact sheet, okay? And here's the link, okay, to the FAQs. And again, click on that, stay tuned because those are gonna be updated constantly. So you wanna make sure that you're familiar where these pages are at, okay? So now let's go into 3205. Okay, who does it cover? Well, 3205 applies to all employees and places of employment. Okay, we do have an exception. Okay, and the exceptions are if you have a workplace with one employee who does not have contact with other people. Now that COVID started, many employees are teleworking. Okay, they're working from home. They're working from another area. So employees working from home are also exempt from 3205. And then we also have employees who are covered by the aerosol transmissible disease, which is section 5199. They are also exempt. Now, I do want to give you, for an example, hospitals. Okay, so it says not all hospital employees fall under ATD. Okay, so we have to look as employees with occupational exposure. So those employees without occupational exposure that maybe are working in the offices or don't have that occupational exposure, they are not going to fall within 5199, but they will fall within 3205. So just want you to be aware of that. Okay. Now, once you look at 3205, this emergency temporary standard, there's a section under definitions. It's very, very important that you look at the section under definitions because when we look later at the regulation, there's going to be some terminology that you're going to say, well, what does it mean? And one that we have here is high risk exposure period. And for OSHA purposes, what this means is if someone develops COVID-19 symptoms, then it's from 2 days before they have symptoms until 10 days after symptoms first appeared. And notice and is underlined, 24 hours have passed with no fever, without medication, and symptoms improved. Or if someone is positive with no COVID-19 symptoms, then it's from 2 days before until 10 days after the sample was collected. So this is for the asymptomatic employees or people, okay? Another definition that we have here is COVID-19 exposure in the workplace. And what we mean by that is that being within 6 feet of a COVID-19 case for a cumulative total of 15 minutes or more in any 24-hour period, within or overlapping with the high-risk exposure period. And notice high-risk exposure period. That's why the definitions are very important, okay? And this definition also applies regardless of the use of face covering, okay? So this is total time in a 24-hour period, not 15 minutes straight times, okay? So now we go into 3205C, which is what it's telling us, what does the written COVID-19 prevention program requires, okay? It requires that all employers shall means it's mandatory that they establish, implement, maintain an effective written COVID-19 prevention program. For those of you that are familiar with the Injury and Illness Prevention Program, which is required of all employers, same language, establish, implement, and maintain an effective, and here's the word effective, okay? And this may be integrated into the injury and illness prevention program, or you could maintain this COVID prevention program separate. Now, we've had questions where people are asking us, well, if this started last March, why did this emergency temporary regulation start in November, at the end of November? Well, now we have 3205, the emergency temporary standard, but Cal OSHA, we've been addressing this since it started, but we've been using the injury and illness prevention program, which is Title 8 3205, okay? So the written program elements, this is basically what the CPP, COVID prevention program, requires. Communication, identification and evaluation of hazards, the investigation, responding of cases, correction of hazards, and training. These first 5 elements, those are elements that are also required of the injury and illness prevention program. For COVID though, we've added a section on physical distancing, face covering, controls, which is the engineering, administrative, and personal protective equipment. And then we also have a section for reporting, record keeping, and access, okay? And then the section under exclusion of COVID-19 cases, and then the return to work. How are we going to get employees back to work? Again, very similar elements to the IIPP. So let's go into the first requirement. It says, the following must be communicated in a form that's understandable by employees. So here it's very important that we communicate to employees how they're going to report COVID-19 symptoms, any possible exposures, and any possible hazards at the workplace. This is very, very important because the employees are the ones, out, doing the work, 8 hours or 10 hours or whatever amount of time out there. So they're the ones that are going to be able to tell you, you know what, it doesn't work here, or we need another hand washing station in this section, or how do I know? I mean, what do I report and who do I report it to? And there's a lot of information out there. You want to make sure that you're communicating this information to employees from reputable sources. Okay, you want to communicate the company procedures, policies for accommodating employees with conditions that put them at an increased risk of severe COVID-19 illnesses. You want to start the communication with your employees before they start that communication with Cal OSHA. As we indicated before, we've been tracking these phone calls, and a lot of phone calls are from employees who are feeling that they're afraid, they're scared. They're thinking, hey, you know what, I have symptoms, and if I don't go to work, I may lose my job, or I'm not gonna, have money to pay my bills. Or sometimes they're calling saying, I think somebody came back positive and they're not telling us who it is, and I may get sick and I'm gonna get other people sick. So before they start that communication with Cal OSHA, you start that communication with your employees, okay? Talk to them about information about access to COVID-19 testing, information about COVID-19 hazards, and what your company is doing, okay, to keeping them safe. And also keep in mind that you need to also address multi and dual employer situations. So if you have employees from other employers coming to your place to either fix something or people delivering stuff, you want to make sure that you're also addressing these situations, okay? You also want to make sure if you have temporary employees, okay, you're getting them from a temp company, you want to make sure that you're protecting anybody that comes into your work site, okay? The next area talks about identification and evaluation of hazards. And with communication, one other thing that I want to tell you also is, remember that we all learn differently. Some of us learn by just hearing, some of us learn by visuals. So you know your employees better than anybody else. You need to do it in a form that they're going to understand, and also without fear of reprisal, okay? So keep that in mind, language barriers as well. So we want this communication to be effective. Okay, Dan. So the next section talks about that identification and evaluation of hazards. You need to screen and respond to employee symptoms. They should be able to come to you and say, hey, I'm not feeling well, maybe I should go home, or what am I supposed to do? Okay, how are you going to respond to COVID-19 positive workers? How are you going to communicate and respond to other employees, okay, that may be exposed? You need to conduct a workplace evaluation of what may potentially expose your employees or other employees who enter your work sites. Okay, limit the entry of anybody else to your work site. That way you're protecting that, that visitor, but you're also protecting your employees that are working at your sites. And as Elliot mentioned, evaluate your HVAC, maximize outdoor air, increase filtration. Okay, also evaluate your COVID-19 controls and see if they work. Do we need to change them? Do we need additional controls? Get your employees involved, because they could tell you where they're sharing, tools, machinery, equipment, what areas need to be cleaned and disinfected. Okay, conduct periodic inspections to identify unhealthy conditions, work practices, and work procedures. Okay. Next area talks about accident investigation. This is investigating, responding to these COVID cases, okay? You need to give notice of the potential COVID-19 exposure within 1 business day. This is in the temporary standard, and this is also within AB 685, which we're gonna address towards the end of this presentation, okay? And you have to make sure that you don't reveal any personal identifying information of the worker. And this is very, very important. And we have many people calling us saying, but they won't tell me. And if they don't tell me who this person is, then how am I supposed to protect myself? Let them know that per law, per HIPAA, we have, privacy, okay, medical privacy. Let them know, okay? Also, all employees who may have had the COVID-19 exposure and their authorized representatives, you need to let them know. And you need to also let independent contractors and other employers present at the workplace during the high-risk exposure period. Remember, we talked about the definition for the high-risk exposure period. That's why it's important to become familiar with that. And you need to offer COVID-19 testing at no cost to exposed employees and provide them with information on benefits. This is one of the questions when this first came out that many employers were calling us and saying, well, what does that mean? Am I supposed to bring a company out to my site and have all my employees tested? And it's like, no, that's not what it says. And that's addressed in the frequently asked questions. You just need to be able to offer that COVID-19 testing to employees, okay? Next area, correction of hazards. Here is where we're going to go into the hierarchy of controls. We need to implement policies and procedures for correcting unsafe or unhealthy conditions and work practices. And here's where we go into, we could eliminate COVID-19, that would be great, right? But that's where we're going, and that's not possible. And it's also not possible for everybody to telework and work from home. We have to go to the shop to get, to manufacture that product. So we need to implement these engineering controls, administrative controls, and then the PPE, which we're going to go a little further into. Okay. Next area talks about training. Training is very, very important. You need to provide effective training to employees, and the training needs to address your company's COVID-19 policies and procedure. You also need to provide to employees information regarding COVID-19 related benefits. Let them know. Our sister agency, Department Labor Commissioner, okay, you could also call them to get additional information. You need to train employees that COVID-19 is an infectious disease that can spread when an infectious person talks, when we sneeze, when we cough, okay? And that it may be transmitted when a person touches a contaminated object and then touches their eyes, nose, or mouth. And we have a couple of videos to help you with that. And also let them know that an infectious person may have no symptoms, the asymptomatic person. Okay. Training, we also need to train on the importance of physical distancing of at least 6 feet and the importance of combining physical distancing with the wearing of face covering. Okay. And also the use of face coverings, okay? And that face coverings is not a respiratory protective equipment. I've had people telling me, well, I can still smell things. So, these things are not working. And here it goes back to training. Well, because a face covering is source control, it is not a respirator. A respirator would have to have a seal to it, okay? So it's very important that we talk about this, that we train them effectively, and also train them on the importance of not coming to work if they're experiencing any of the COVID-19 symptoms, letting them know what these symptoms are, and obtaining a COVID-19 test if they have symptoms. And hand sanitation. Hand sanitation is not new to OSHA. We have a separate regulation for that, but it's very important now more than ever that we train them on properly washing our hands. You know, we talk about the 20-second rule. It's important that we train them on using the soap, the water, you know, and if that's not available, the hand sanitizers, okay? And it's very also important that we have soap and water available and that we're also giving them the time to go and complete the hand sanitation, okay?
Carmen, I just want to pipe in here real fast. If you're going to use a hand sanitizer, you want to make sure it has enough alcohol content in it. And one of the things is some manufacturers have been making hand sanitizers with something called methanol or methyl alcohol. And methyl alcohol can get absorbed through a person's skin. So you do not want to use a hand sanitizer with methyl alcohol in it or methanol. The problem is if you look at the label, it usually will just say alcohol and the percentage. You might have to go to the safety data sheet or contact the manufacturer to make sure that the hand sanitizer does not have methanol in it.
Thank you, Dan. Very good point. The next area, and this is a 3205C6, here we need to train and we need to ensure that we're practicing physical distancing, okay? Employees shall be separated from other persons by at least 6 feet, okay? Except when 6 feet of separation is not possible and except for momentary exposure while people are walking. And I know Elliot went over some good tips, okay? Telework or other remote work, reduce the number of persons in an area at one time, including visitors, staggering, you know, start time, end time, break times, okay, adjusting the work process or procedures to allow for more distance, and using visual cues such as signs and floor markings. You know, we're seeing this more and more when we go to the supermarket or any store, we're seeing the cues. So this is something to, when you're doing your evaluation, your hazard assessment, pay attention and look at where our employees at, where do we need to implement the physical distancing, okay? And the next slide, Danny, you're going to talk about face coverings. Correct?
Right, I'm going to take over now. So the next part of the regulation addresses face coverings. And what we're seeing are all different types of face coverings available. It's pretty much a free-for-all right now. And pretty much most of the face coverings are acceptable. We want to make sure that if you take your face covering, kind of hold it up to the light, you shouldn't see the light through it. So you might see things that are multi-layer. There are working on a national consensus standard for as a voluntary guideline for the design and development of face coverings. But you want to make sure that you're providing your employees with face coverings, and the regulation actually requires that you ensure that they're worn by employees over the nose and mouth when they're indoors, when they're outdoors less than 6 feet away from another person, or if the California Department of Public Health, the state health department, or a local health department issues some type of order requiring the face coverings. Now, on the right side of the page, the top two images, the top left is a woman wearing a cloth face covering. You can tell she's wearing it very well. It's covering her nose, mouth, goes way under her chin. You could see on the side of her face that the fabric is kind of puckered. And then also, if you ever have worn one like this and you wear glasses, you know a lot of the air escapes around the nose because there's a lot of these do not have a metal band in them to bend around the shape of the nose. So as Carmen mentioned, these face coverings are source control. They're not respirators. Respirators are designed to protect the person who's wearing the respirator. A face covering is designed to be worn by a person and protect the people around them from what they're exhaling. So the concept, the one on the top left is a cloth one. The one on the top right is more like a surgical mask. That style is a surgical mask. And you could tell that the surgical mask has a little tighter fit to the face. It looks like it has a band in it that bends over the nose to create a better seal around there. So both work very well, but the surgical mask actually works a little better because it fits tighter to the person's face. On the for a while, early on in the pandemic, we saw a lot of people just wearing a face shield without a face covering. That a face shield is not a replacement for a face cover. You could wear both a face shield and a face cover, but not just a face shield. You need your mouth and nose covered. And this bottom right image, the concept, that when you exhale, the droplets and aerosols are coming out of your mouth, and they're impacting on the inside of that face covering. And that's why you want to clean them frequently, is because the inside gets contaminated with your exhaled air. And one of the big concerns with face coverings, and why there's such a push to use the face coverings, is when people talk or even just breathe, a lot of droplets are coming out of the person's mouth. A lot of aerosols are coming out of the person's mouth. And most of it is invisible to the naked eye. Every once in a while, when somebody's talking, you'll see a little bit of spit coming out of their mouth. But we're going to see in the videos I'm going to show now, that when talking, these droplets and aerosols are coming out of a person's mouth and nose that are invisible to the naked eye. And that is how the virus is being transmitted. So if they've actually found that if you're using a face shield or something protecting your eyes along with the face covering, that actually that lowers your risk of infection even more. So it's a good idea if you can wear a face covering and something over your eyes. That really does help protect people. Now, I want to show this video quickly. Let me make this, hopefully this works. Give it just a second. If not, I will. Oops. Okay. This video has somebody talking, and you'll be able to see little droplets and the aerosols coming out of their mouth. You'll see the droplets that are the larger things that start falling down to the earth faster. And you'll hear this person say a couple words at 3 different volumes while not wearing a mask, and then saying the same things again while wearing a mask. So this shows the effectiveness of masks. And this video is from the New England Journal of Medicine. You'll notice also he really emphasizes some of the words.
Now I'm recording. Stay healthy. Great. Stay healthy. Great. Less loud. Stay healthy.
So in this video, you were able to see just the droplets that come out. And when somebody's talking, you don't see droplets coming out of their mouth. So all of those little green specks were the invisible droplets to the naked eye. So now they're going to do the same thing wearing a mask.
Are you recording? Yeah. Stay healthy. Louder. Stay healthy. Louder. Stay healthy. Nothing.
Okay, I'm going to stop the video there. It's actually like a little over 2-minute video. The rest of it is showing what we just saw in slower motion. So that video shows the effectiveness of face coverings. Now, in this video, it was in a laboratory setting. I think they were wearing more of an N95 style mask versus just the normal cloth face coverings that we're wearing now for the pandemic. But you could really see the effectiveness of a mask and how they work. Okay, let me go on to the next slide. I apologize, for some reason, this video embedded wrong, or weird right now. But let me just explain. This one came from the Journal of the American Medical Association. For some reason, it's chopping off the bottom, so you're not seeing the distance. But this is showing the droplets and aerosols coming out of a person's mouth when they sneeze. So the first part of the video is showing the droplets and aerosols coming out of the person's mouth in the first quarter second of a sneeze and how far it travels, like, 20 centimeters away, the concentration of the droplets. And when most people sneeze, you're not seeing any of the visible droplets. So this is what's being spread in the air, and those droplets and aerosols are what contain the virus. This is showing the spread over about 3.5 feet within the first quarter second. And again, you could see the larger particles are going to drop to the ground faster, and the lighter weight stuff stays suspended in the air. And that's what we're concerned about, because this is an airborne transmission of this virus. And the last video, again, you're not going to see, but it's going to show how far a sneeze can travel. So that cloud can travel like 20 to 25 feet away from a person who sneezes. So I just wanted to get, trying to show these videos because it gets the point across about the issues and why it's important to wear a face covering, because most of the stuff is invisible to the naked eye. And, people are, it's like, why do I need the mask? It's because we're trying to protect the people around you. But the masks actually do provide some protection to the person who's wearing it as well. Now, there's some exceptions to the face covering requirements. If an employee is alone in the room by themselves, they don't have to wear the mask. If they're in an area where other people are working, then they have to wear the mask. So it's always required when there's other people around. For in manufacturing, if you have an office environment, if you have an office with a door that closes, the person in that office could take their mask off because they're alone in that room, but they need to put it back on when they leave the room and are in common areas. If you have a common area with a few desks in it, then those employees are going to have to wear a mask because they're not alone in a room. You're going to have, you can take your mask off when eating or drinking, so when you're taking breaks. And again, you want to encourage the employees to take the mask off only while they're eating and drinking. And this is a big thing we saw when restaurants were open. And now that restaurants are reopening in Southern California, people will take their mask off for the entire time they're at a restaurant. Ideally, what you should be doing is taking your mask off while eating and drinking and then putting it back on again. So you want to make sure that people are at least 6 feet apart. And Elliot was showing some pictures of like break areas, and you're really going to have to make sure those employees are spaced apart. And that's why he talked about staggering start times and meal times and break periods, because that way you can get people to take their breaks at different times, which allows less exposure. You'll have less people in a room. You're also already automatically going to have much less people in a break area because of the 6 foot requirement to stay apart. If you're indoors, you want to, again, increase the ventilation as much as possible. There's certain tasks that you just can't do while wearing a face cover. And if you're doing one of those tasks, you're allowed to not wear the face covering while you're actually doing the task. Up until that point, you should be wearing it. And anyone who's unmasked while doing, when they take their mask off, what they have to do, for the specific task where they can't wear a face covering, anyone less than 6 feet away from that person, if it requires a couple people, then you're going to have to test those employees at least twice a week for COVID-19, send them for testing. And this could be an issue in manufacturing because, a lot of machinery is fixed. If you're doing food processing, a lot of equipment is movable for sanitation purposes. You could move so you can clean, but a lot of manufacturing the equipment is fixed. And if it requires 2 people to operate a piece of equipment or to work together less than 6 feet apart, and for some reason they can't wear masks, those people are going to need to be tested twice a week. Here's a way to get around if you can't wear a mask. You can use a face shield with a drape. This is a picture of a face shield. It allows a person to not wear a mask, and that drape part that's going from the bottom of the face shield that kind of straps around the person's chin is equivalent of a mask. What that does is when the person talks, they cough or sneeze, the droplets stay contained within the mask, within the face shield. So you're allowed to do that as well. One thing you cannot do is you can't just decide, you know what, we're not going to have employees wear masks and we're just going to test them twice a week. You need to have employees wear masks when it's, where it's feasible. And I think on that last slide where we're talking about the specific tasks, those need to be very limited on when you cannot wear a mask. It's just because of some type of safety issue, or you have to wear something on your face that interferes with the seal of the mask or something like that. Those are the unique situations. Whereas every time somebody should be able to wear a mask. The other time there is an exception for face coverings. There are some people that have health conditions, mental health conditions, some type of disability, where they just cannot wear a mask. And in that case, if they can't wear a mask over their nose and mouth, a face shield with a drape is an option, or you need to address, what can you do to reduce this employee's exposure to other people? Now, Elliot had some really good examples of engineering and administrative controls, and this is basically kind of what we were talking about, what he was talking about. Engineering controls are typically more physical things where you have people work from home. That doesn't work in manufacturing. You need people there at the facility to do the manufacturing. Non-essential businesses, were closed for a while, and that was at a state level order. Engineering controls are things like adjustments to the ventilation system. What were the physical barriers? My big thing, what I tell people, engineering controls are typically physical changes in the workplace that employees really don't have to think about. The ventilation system is just on. They don't have to think about the increased fresh air. They don't have to think about the filtration. If there's a physical barrier to separate employees because they can't from each other or from employees and clients, it's not something they really have to think about. It's just something that's there. Whereas the administrative controls are things like more policy driven, the requirement to wear a face covering, to, having people stay home when they're sick. You could, instead of working 1 8-hour day with a full shift, you could work 2 shifts within one day, a day in a swing shift with half the number of people. So, that would reduce the number of people that are exposed. So the increased frequency of cleaning and disinfecting of workstations, those are policy driven. So that's a lot of the administrative controls that we're talking about. So again, here's an example of a person, there's a nice, this person is working in food service, but the concept is the same in all industries. That this is the physical barrier that if you have to be closer than 6 feet to somebody, that you can wear, or you wear your mask and you have this physical barrier, and that physical barrier is designed to prevent any droplets or aerosols to transmit between people. The problem with barriers is if they need to be high enough, they need to be wide enough and deep enough, that people just aren't going to kind of lean back and talk around the barriers, because then you have issues of the exposure. But the barriers are a great engineering control. Elliot also already talked about that list N, the EPA chemicals that work for this coronavirus, and this is a hyperlink so you can find that list. One thing that I will really stress is if you look at the list of chemicals, these chemicals that are effective against COVID-19, try and find one that has a low contact time. The contact time is important because it's the amount of time that that chemical has to be in contact with the surface to disinfect it. And we'll see chemicals with contact times ranging from 15 seconds all the way up to 10 minutes or 15 minutes even. So the shorter the contact time, the faster it will kill the virus. So it's a good idea to look for something that has a short contact time. You want to prohibit the sharing of PPE unless you disinfect it between use. Not just PPE, basically anything that's shared. You know, if you have any type of equipment, and this again is common in break areas, we'll see, you know, the door handle for a refrigerator, the handle for a microwave, the touchpad for a microwave, or the knob, you know, restrooms, the grab handle or the push bars, anything like that that people come in contact with, you want to disinfect frequently in between use. And as Carmen mentioned earlier, make sure you have enough hand washing facilities. There are a lot of portable units that if you don't have enough hand washing facilities, you can bring in a portable one to provide more hand washing stations for your workers. One of the things I want to talk about as far as PPE, while during the pandemic, a lot of people are referring to we're calling face masks PPE because it helps protect people. In OSHA terms, when we talk about PPE, we're talking typically more things like respiratory protection, things that are protecting the wearer of the mask. And you need to do an assessment to see what type of PPE is needed at your facility. We've always required you to, or not always, for the last 10 years or so, we've required a PPE assessment of what's needed in your workplace. But now, as part of the pandemic with COVID-19, you need to go through your workplace again and see if anything different might be needed to protect employees from the virus. You also might need to look at respiratory protection, that if you can't physically distance people, you know, the 6 feet apart, you might need to start looking at the use of respiratory protection. Now, N95s are hard to come by. As Elliot said, and we've been encouraging this too, really we've been encouraging people to try and leave those for the healthcare professionals and our frontline workers who really need them. But on Cal OSHA's website, under our wildfire smoke section, we actually have a list of vendors that say that they have at least 100,000 N95s available posted on our website. And there's a list of about 15 or 20 companies at any one time where you can find the N95s from. Most of the ones I'm seeing on that website are brands I've never heard of before, but they've met the NIOSH requirements. And the other thing is, you know, if you need respiratory protection, and if you're finding a shortage of N95s, you might want to consider going to the higher level of respiratory protection, which are the top photo, which are elastomeric respirators, which are half face or full face. And then, you know, while dust masks on the bottom are disposable, you can reuse those maybe 5 times, you know, 5 times putting them on or off the person's face. The ones on the top are designed to be reused for years. So you can reuse those over and over again, and you just change out the little cartridges periodically. And especially for something like a virus, that cartridge is going to last a really long time. The trick is, if you mandate respirators, you need to implement a respiratory protection program. If you allow their use voluntarily, there's much less you have to do. So if they're elastomeric, you have to do a medical evaluation. You need to have part of a written program that addresses the cleaning, storage, and maintenance of the elastomeric respirators that are used voluntarily. If they're the dust masks, you just provide the basic use and limitations to employees and give them a copy of Appendix D of the regulation. And the basic training is, these are filtering face pieces. They don't work for gases or vapors. They don't provide oxygen, you know, just very basic stuff like that. I want to point out we're seeing a lot of KN95 respirators, and probably before last April, you probably have never heard of a KN95. KN95 is equivalent to the United States N95. N95s are basically certified by a certification by NIOSH, the National Institute for Occupational Safety and Health, which is the occupational safety and health branch of the Centers for Disease Control. So they test the respirators to make sure they're filtering properly and they, that they're doing what they're designed to do. KN95 is a designation in Asia for respiratory protection. And what we found is testing some of the KN95 respirators that are being used in the United States. We found a lot of them do not meet the filtering requirements to filter out 95% of particles greater than 3 microns in size. We're finding they're not fitting the people properly, so we're getting a lot of leaks in those. And even the legitimate manufacturers of KN95 respirators are saying there are so many knockoffs and counterfeits that haven't been tested and don't meet the filtering quantity. So what we're really recommending, if you're going to use a KN95, to use it as a source control, just like a cloth mask or a surgical mask. You could use a KN95. They work great as a source control. As respiratory protection, we'll allow them to be used, but only as an absolute last resort. And we have guidance that you have to make, show that there's a shortage of N95, that you've considered going to elastomeric respirators. There's a lot of steps you have to get to before we'll accept the KN95 as an actual respirator. Now, this is an area where we get a lot of questions, and this part of the regulation deals with reporting, recording, and access. And so reporting for COVID-19 is reporting cases to the local health department. Typically, when you have somebody tested, or when somebody is tested and they're positive, the laboratory is going to notify the health department, and the health department will start their contact tracing of that person. But there's also a reporting requirement to OSHA that if you have a serious injury or illness, that you have to basically call that into OSHA. And when it comes to COVID-19, if it meets the reporting criteria, which is a fatality, hospitalization for treatment, those are typically the two things that will trigger reporting requirements to OSHA. Or if the onset of the illness just occurs in the workplace. So our regulation says if it meets if it's work-related and meets reporting criteria, then you call in the case to OSHA, the local enforcement office. However, there's a little sentence in the regulation that says if the incident occurs in the place of employment or in connection with employment, then you'd also need to call it in. So if somebody came down with symptoms in the workplace and they ended up being hospitalized or they end up dying from the disease, you need to call that into OSHA. And then as far as other record keeping, we'll talk about the OSHA log 300 in a little bit. But any of the records under this regulation, you're going to do just like with the IIPP. Document your training, document your periodic inspections of the workplace, your hazard assessments, document your corrections, the fixes you do, whatever you've done to implement to make a safer workplace, and hold on to those records for at least 1 year, which is what the IIPP requires. Now, if you have an employee that tests positive, you're supposed to exclude that person from the workplace. And our regulation actually says you need to exclude that person for 14 days. Now, best practice still is 14 days. But in early December, the governor signed an executive order reducing the 14 days to 10 days and to match the guidelines put out by the California Department of Public Health. So in OSHA, we're supposed to be using 10 days instead of what's actually written in the regulation, 14 days. and that's because of a governor's executive order. Ideally, 14 days still is the best practice, but 10 days is the minimum. Employees can return to work. There's some guidelines that you have to follow. So after you have a person that's out because of COVID, somebody who's COVID positive that has symptoms cannot return to work until at least 24 hours have passed. They have to be below 100.4 for at least 24 hours without use of fever-reducing medication. Their symptoms have improved, and it's been at least 10 days since the symptoms first appeared. So that's what the trigger is to let an employee come back to work, is 24 hours since they've had a fever over 100.4 without fever reduction medications, the symptoms improved in 10 days. There actually is something for, you can reduce that even to 7 days, but that typically, that exception will not apply to manufacturing. It's really for healthcare and certain social services where you have like face-to-face contact, like child protective services. If they have a shortage of staff, they can return to work after 7 days with some additional requirements, but it doesn't apply to most industries, and it definitely does not apply to manufacturing. Now, workers who test positive but never develop symptoms, again, because of the government's executive order, instead of 14 days, it's now 10 days. And the 10-day period is from the date of sample collection. So if they tested the date the sample was collected, it's 10 days from that point to be able to come back to work. And there is a thing that says a negative test shall not be required for an employee to return to work. And the reason for that is because we're finding that people that are positive, they don't automatically test negative on day 11. So, we have several people, you have people that are testing positive for several weeks after their symptoms have disappeared. And that's just their body, the antibodies in their body, and you know, they're still showing a positive test. So if you relied on a negative test, they might be off work for weeks at a time. So that's why we're saying that a negative test is not required. So that's kind of the basics of the regulation. I want to talk quickly about the next two sections deal with multiple outbreaks at work. So 3205.1 deals, I refer to it as if you have a minor outbreak, and 3205.2 is if you have a major outbreak in the workplace. A minor outbreak in the workplace is considered 3 or more cases in the workplace within a 14-day period. And then as long as you continue getting more positive cases, this 14-day period keeps extending until you've gone 14 days without a case. So this is 3 cases within a 14-day period will trigger the requirements of 3205.1. And within this regulation, there's 5 things you need to do. You need to do testing, you need to exclude the cases, you need to do an investigation, you need to basically do the investigation review and correct the unsafe conditions, and you need to notify the local health department. Let me just, so the testing for a minor outbreak is it's going to require testing of exposed employees, not everyone, people that worked around this case, you know, these positive cases. The people that work in those areas are the ones that need to be tested, and the testing requirement is once per week. Then you're going to exclude them, just like we talked about in the other regulation. And it actually just, that's all it says. You're going to exclude the employees based on the requirements of section 3205. You're going to do the investigation just like 3205, but you're going to do that once a month until you're out of this, out of the requirement of 3205.1, after you've gone that 14 days with no cases. Then you're going to document your investigation, review your policies and procedures. You're going to implement your corrections. And this is a case, as soon as you have 3 or more cases in the workplace, you need to call your local health department and report that you had an outbreak in your workplace. I will tell you, a lot of them don't want to know if it's only 3 people, but some of them do. If you call them and they don't want to take the information down, just document that you made a call, who you spoke with, and you attempted to notify the health department. The next section, 3205.2, deals with a major outbreak at your workplace. And this is where you have 20 or more COVID-19 cases in your workplace within a 30-day period. Now, this is going to be, typically it's going to be a larger employer that has a lot more employees. These tend to happen in manufacturing more. We tend to see this a lot in like food manufacturing, where people are working close together on a production line. We've seen it a lot in the meat processing industry. So it just depends on your setup and how close you have people working together. If you have a lot of people that are working close together and you can't keep them that 6 feet apart, this is where you have the higher risk for this major outbreak. And again, the same thing, it goes until you have no new cases for a 14-day period. These sections are similar to the last section. The testing now becomes twice a week. The exclusion is pretty much the same. Investigation's the same. The hazard correction this time, though, mandates that you look at your ventilation system, increase the ventilation, install a MERV 13 filter if you're into the system, if it's capable of handling it. And if not, look at portable air purifiers in the workplace, and the same requirement for notification to the health department that you're having a major outbreak. So that's kind of a quick overview of that. And now I'm going to hand it back to Carmen to go. Does anyone here have housing or provide housing or transportation for your employees? Hit the space button and just tell us yes or no. It doesn't sound like anyone does. So Carmen, it's all yours, and you can probably skip over.
Yes, thank you, Dan. Thank you very much. Yes, there's 3205.3 if you are providing employer-provided housing. If that's the case, please look into this. If not, attend our 3.5-hour training. So we'll go ahead and skip over that, as well as the transportation to and from work. And for that, you want to look at the scope and see whether it applies or it does not apply. Okay. So next, we're going into our frequently asked questions and resources. As I indicated before, Dan and I, we are with OSHA consultation. Many people, many employers, they know about OSHA and they always think of enforcement, but there's also a site to consultation. And this is the department where we work, and basically we work for you. We work for you as an employer. So in order for consultation to help you though, we must be invited. I come from enforcement, and I thought when I came over to consultation, I was gonna help and assist all these employers, but then reality hit that employers, they have to invite us. I highly, highly recommend that you call our office. It's a free service. There's no citations, there's no penalties. Consultants work with you on a proactively basis. You request our services, we assign a consultant, you schedule a date and time. That's one of the big differences with enforcement. Enforcement, ready or not, they show up. With consultation, we schedule an appointment. Now, what's the catch? The catch of using consultation is that we're going to go ahead and look at your programs. If you don't have any, we'll help you with that. We're going to look at your IAPP and we're going to evaluate that and give you feedback. We're going to do a walkthrough, and if we see any hazards that are based on Title 8, we're going to go ahead and write those down and include those in the reports. Now, the catch is that anything that we put in our report that we're going to identify, just like enforcement does, regulatory, general, and serious. We're going to put that in the report. And the catch is that you have to fix anything that's categorized as serious. And for Cal OSHA purposes, a serious is, the definition is that there's a realistic possibility that in the event of somebody getting hurt because of that violation, it may result in a serious injury, which Dan described the definition of a serious injury. What I tell employers, you're going to want to fix these things, not because we're asking you to, but hopefully because you don't want somebody getting hurt. It's not good business for anyone. It's not, the cost involved, interruption in production. So anyways, we're here to help you. We have 7 different offices throughout the state. So you could call our office. We could assist you. We could do the on-site, but we could also we have a duty person every day of the week, every office. So if you have questions, call our office. We're here to help you. And also keep in mind that on-site, it's confidential. We do not talk to enforcement about it. The only way we could refer you to enforcement is if you refuse to correct these hazards, which most employers, they want to take care of it. The next thing is the frequently asked questions. Here we have the ones on the 300As, which right now, February 1st is around the corner. It's the posting period for your 300 logs and the summary. Here's the FAQs on that. And we also have FAQs on the emergency temporary standard. Okay, so I highly recommend you visit this links. AB 685 came into effect January 1st of 2021. And here it allows Cal OSHA to issue orders prohibiting use to shut down an entire workplace if it exposes employees to an imminent hazards related to COVID-19. The other thing that 685 does, it's that enforcement may issue citations for serious violations without having to give that 15-day notice or what we know as a 1BY to an employer when they're thinking of issuing a serious citation. Okay. It also, the next slide talks about notifying within 1 day all employees at a work site of potential exposures, COVID-19 related benefits and protections, and the disinfection and safety measures that are taken at the work site. Okay. And also here it talks about employers that are required to notify the local public health agencies of all workplace outbreaks. And it's defined as 3 or more confirmed cases of COVID-19 among employees who live in different households within a 2-week period. Okay. Here, what we have, this is the Divisional of Labor Standards Enforcement. Please visit their page. If you have questions, call their office in relation to the benefits that you're supposed to provide to employees. CDC, NIOSH is also a very good resource that you may use for training purposes. There's good information here. A lot of it is specific to the industries. OSHA has a lot of information, but keep in mind if you're working in California and it's California jurisdiction, then Cal OSHA regulations is what you need to look at. Okay. And then the Department of Public Health, CDPH, very important. You're going to find a lot of very, very good information here. Okay, and here's Cal OSHA's coronavirus webpage. We have a webpage specifically for COVID-19. There's guidance documents. There's the frequently asked questions. Here you're going to find the webinars on COVID-19 that are scheduled for February and for March, and then our page. Okay, and here you can find the actual regulations and how to contact, any of the office consultation and enforcement as well in case you need to report any of it.
And Carmen, I need to update this slide because the very first blue box on this page now is the actual regulation where you're going to find, it'll be linked, the temporary emergency standard where you can read the regulation. It's got the sample written programs in English and Spanish that in Word format that you could save to your computer. It's got the frequently asked questions related to the standard. So just be aware that our website was updated and the first blue block is actually the regulation and where you're going to find most of the information you need from our website.
Thank you, Dan. And here you're also going to find this Cal OSHA Training Academy. It's for employees and employers. It's very neat in the sense that it talks about COVID-19, then it's a module, then it has 1 or 2 questions. And once you're done with everything, it gives you a certificate. So something to look at, for the training of your employees. Okay. And here you can even find the policies and procedures. And I'm sorry, we went through it quickly. But on our website, you're going to find a lot of information, and you're always free to call our office if you have any questions. Okay. And now I'm gonna turn it over to Traylon Brutley. He's the Senior Business Development Specialist with the Governor's Office of Business and Economic Development, GO-Biz. Thank you.
And you're still muted, Trey.
There we go. Sorry. Thank you, Carmen. And I hope everyone can see me all right. So good to go. I'm going to share. If someone can grant me screen share, and then I'll be able to share my screen. There we go.
There you go, Trey. I just got you.
Great. Awesome. Is everyone able to see my screen all right? Great. So thank you, everyone. And thank you for holding in at this point. I know that we're coming up on 3 o'clock, so I will be going through this information fairly quickly. And, you know, I will say that my email is right there. My phone number for our office is right there. We have a growing team, including a new inland. I'm from the Inland Empire and have covered the region for our office as a senior business development specialist. I'm now located here in Los Angeles. We actually have a new staff specialist, particularly for the Inland Empire, who is located also in region. And we have another staff even coming down potentially along the line. So there is a lot of staffing resources regionally that we're able to now bolster as GO-Biz. We're really looking forward to the relationships we're able to build with you as individual businesses and manufacturers to be able to find incentives, credits to really help you succeed. So that is really what our team is for. And I'll go to the next slide here to kind of run that over. We're really the point of contact for business economic development and support of the state of California. We have our business investment services team, which is what I am a part of and spend half of my time of my work on. And that is tailored consultation at no cost. Site selection will help you find sites within 14 days if you are considering another site within California, or you know a company that's interested in looking to locate within California. And then we provide incentive navigation. So hearing where you are, what you're looking to do, telling you the incentives that you can use. We also have permit assistance, international affairs and trade assistance with export-import trade, Office of Small Business Advocate, and then we have a program called California Competes Tax Credit, which I'll be talking about today. So incentives for California businesses, here's our main page. And if there's one website I want you to remember off of this from my presentation is business.ca.gov. And it's a very intuitive, easy to utilize website. You can see here, there's no language about what types of teams are in GO-Biz or what things that we really do within GO-Biz, because the idea is here is you in the business. And so you go here, you go to industries, you click manufacturing. If you go to that page, there's not a ton of language. There's literally just links to the incentives and things that you need to go to be successful. So this website was revamped this year and it's very easy to use. I personally love it. So I was a small business owner too, and I've really have worked to see different types of sites, and I really like this one. So I encourage folks to use it. You can always reach out to us there in the contact us form. And I've also put here how you see the industries here, and you can scroll down and select manufacturing. We also have some updates on the top, so including about the California Relief Grant, which I'm sure folks here on the line have heard about, as well as disaster resources for those small businesses, small manufacturers affected by COVID and the wildfires. So the first incentive material, we actually just closed a window for this incentive, California Competes Tax Credit. And I would say that I'm about to go over tax credits right now. I'm also going to talk about some of the grants and upcoming stuff that is coming for business. But I share these because most people don't know about some of these tax incentives, and they are something that you can really utilize and maximize, especially as a manufacturer. The first one is California Competes. This is for businesses who want to grow and stay in California. So it's a tax credit, income tax credit. You're allowed to request what you think you need to be successful, 5 years, 5-year period. So you can use that tax credit down in different years. It's an income tax credit, corporate income tax credit. And it is, we have 71 million available in the March round. There will be another 3 rounds in the next fiscal year. And so even though, you know, you think of different things in planning, you may have like year 4, you project success and you may be able to utilize that tax credit. It's for that expansion element. It's also for retention. You're able to go to the state and say, look, I need a California Competes tax credit because if not for this tax credit, I would potentially close my operation or move my jobs outside of California. So it has a retention angle as well. So California Competes is probably the most sought at business incentive that we have at the state level. The next is the R&D income tax credit, which many manufacturers use. So developing new processes, if you are making third-party payments for R&D, if you are making any type of expenditures related to engineering knowledge for you, your staff, those types of qualified expenses can be claimed as an income tax credit through the Franchise Tax Board. You have to use this income tax credit down in the year that you are making those purchases. So unlike Cal Competes, you can't use it in the next year. The next one I have is the third income tax credit, which is the new employment credit. If there is an employee that you're hiring from a specific area, they are unemployed recently, they are a recent veteran separated from the armed forces, they're an ex-offender, they've received CalWORKs, earned income tax credit. These are all qualifiable things for that employee. You can receive a income tax credit in the form of 35% of that qualified employee's wages over 5 years to be utilized for each year that you have that employee on file. So there's lots of folks who utilize this tax credit, and there's lots of qualifiable census tracts for these employees where you're able to achieve this tax credit within California. And then the next two tax incentives are not credits. They are exemptions from sales and use for manufacturers. So we have a partial exemption that is available all the time to manufacturers. So just to go back, this is not competitive, this is not competitive, and neither is this one. So this one is, you can claim at any time when you go to make a point of purchase. To get it in writing is a form, short form that you file with you when you go to the vendor to make a purchase for manufacturing equipment. Covers a lot of use cases in manufacturing, so I've seen it be used on a lot of different things. You can also potentially, it's a little bit more difficult, and I share with manufacturers to do this at the beginning, but you can also go up to 3 years and potentially go back for those state sales tax payments that you made on prior equipment purchases. So it covers that 3.9%. It also covers R&D. And if you have agricultural equipment, up to the 5% mark. So this is available all the time from the state, this sales and use tax exclusion. And we share with manufacturers that they really should be maximizing this incentive that we offer as California. The next is the full sales and use tax exclusion. So what I shared was the partial, where you can always available all the time. It has a $200 million cap. And so you can go for that all the time and be able to, remove that state obligation. We have a competitive program, which will actually come in. If you apply, you're awarded. We will, as the state, come to pay not only, exclude you from the state sales portion of the sales tax that you're obligated for advanced manufacturing, recycled feedstock, alternative source products. We'll also exclude you from having to pay any local or other special district sales tax portions that you have. So that 4% plus city, county, special district, any associated sales and use taxes that you may have in addition to that. It's a competitive program that opens up at the beginning of the year. It is already opened. We already suspect that it is overutilized, oversubscribed for this period. However, I will share in the end, there is a budget proposal to increase the funding by $100 million. The other thing is that there's a $20 million set aside for small businesses, small manufacturer projects. It's administered by the California Alternative Energy Advanced Transportation Financing Authority, or CATFA, which is a really long acronym. So I will just stay with full sales and use tax exclusion. So to go to the next one is not a tax incentive at all, but I really like to share this one with businesses that they can utilize. It's available also all the time, also not competitive. This is offered by SoCal Edison. It is an economic development rate, and it is a 12% reduction on your utility bill over 5 years that you're locked in year to year. If you provide a business case to Edison that is then also approved by our office and our team, if you have critical need for this type of incentive and reduction in your utility bill based on, a factor is, if not for this incentive, I would potentially close my operation or close jobs or, lose my business or, reduce my footprint or these types of things, or I would potentially move my operation out of the state of California. So it's that if and or type scenario, and then SCE reviews you, they go do a site, they review your bill and your kind of history, and then they'll go for an approval with our office with a business case, and then we can get you in on that rate. So energy incentives. So the last is, I'm just going to run through some generic, broader resources. The one is that, I said the CA relief grant, which is small business grant. We have another round opening next week. We had 500 million in the last round. We have 575 million coming up in the next round. That's CA relief grant. And so we have the Office of Small Business Advocate also, right, able to find on the top of our page. This is where you can find also some small business resources. I know there's small manufacturers on the line. The CA relief grant, the California Rebuilding Fund, which is a loan fund, training webinars, connection to SBDCs, those types of things. So the Office of Small Business Advocate is also a resource for you at the state. The last is, one of the other ones I want to share is the California Grants Portal. We're very lucky as a state that we have this site up now. It's kind of something that's great to have in comparison, and other states have been looking to model. Everyone is probably familiar with grants.gov, which is a federal one-stop shop for all federal grants. We as a state have created a state version of grants.ca.gov where you can find all state grants located in one place. So business.ca.gov is a place to know, and I'd also share grants.ca.gov as a place to know. So this just launched this very recently. You can say, I am a business, I'm looking for a grant in science and technology or R&D or manufacturing or agriculture, and I need it within 3 months, and it'll tell you it'll just populate what opportunities are available. For manufacturers, there is a partnership that we launched over summer that is still ongoing. There's a safelymakingca.org, and that was a partnership with California Manufacturing Technology Association and the Autodesk and GO-Biz and OES marketplace for manufacturers to sell and procure PPE equipment with partners. Also for those employers who need PPE to be able to go and access Safely Making, to be able to find PPE resources should they need them. And the last slide that I have is really a sneak peek in what is to come. And as you can see here, I couldn't even fit it all on this slide, and there's more to be said on this. There is a link up here, and when I provide the PowerPoint for follow-up that you all can review, there's links at the top of each of these things. So this is a link as well. This link is a link to a video of where the governor is going over his business incentives and business resources he has proposed in the budget. So the governor unveiled, of all elements of the budget, he started first with business, and he released a huge slew of programs, incentives that are utilizable by businesses, potentially if the budget is passed. So it's a proposed budget, so it does have to go through the legislative process. So the California legislature will have to come to agreements, of course, within the legislative process with the budget, but it includes an expansion of California Competes tax credit, including a grant program, a California Competes grant program. It also includes $100 million to extend the small business tax credit, which can be used for part-time employees. It can be used for sales tax. $35 million to create a dream fund for seed grants for entrepreneurs and small businesses. $50 million to expand business loan guarantees at our iBank. $62.5 million for the rebuilding fund. $100 million to that full sales and use tax exclusion for manufacturers. So the competitive program, the $575 million that I shared, which was moved in an early action item in the budget to expand those small business grants, $353 million for one-time and ongoing investments for workforce training and supplementation. And then the last is the large one was also the waiver for barbers, cosmetologists, bars, and so on. But there is also other. If you go see in the governor's presentation and also in the budget itself, there is a lot to be seen in the future for business incentives and programming. And we're very looking forward to having potentially new programs and resources to be able to share with you all, and also complement our new staffing within region to assist you from the state. So that concludes my presentation. Business.ca.gov is a place. There's my email and my phone number as well. Always great to come on to a webinar and hear with the folks of Corona. I shared I'm from Hemet, which is not that far, right around the corner, but it feels like, all of the Inland Empire could be home. So just wanted to thank Jessica, the Chamber, everyone here on the team and the folks at Cal OSHA before for having me here. And of course, feel free to reach out at any time. Thanks. And I think I'm turning it back to Jessica. So.
Excellent. Thank you, Trey. And thank you to our presenters for doing an amazing job in delivering so much information in 2 hours. Now we want to, of course, have an opportunity for questions. So while Linda is seeing the questions in the chat, I want to remind you of a couple things. The first is that the Corona Chamber of Commerce has free disposable one-time use masks. So if you are in need of masks, please contact them. Also, the City of Corona, as I put in the chat, has a $5,000 business grants available to assist with the purchase reimbursement of PPE. So please, these are 2 sources available to you. Now, Linda, do we have any questions for our presenters?
Yeah, we have a couple here. I believe the first one was for Elliot, if he's still on the call. The person said, I had complaints regarding safety glasses, fogging while wearing masks. How do we handle that? And what is the best approach?
So the best thing that we've been recommending for companies is just to use warm water and soap. The soap seems to leave a film on the goggles, and it helps with moisture accumulating on there. There are some chemicals that you can buy. I know that they're for sale. I don't know how effective they are. I don't have any personal experience with those, but I see them for sale on Amazon, so that might be another route. But I would always start with soapy warm water and keeping them clean.
Great. We have another one for Elliot, since you're still here. Do you have any recommendations for how to best manage the time clock and allowing staggered times for clocking in and clocking out when companies have hundreds of employees?
Sure. It revolves around a large Excel spreadsheet that is a matrix with staggered start times. So if it's possible to group the employees by area or by process or by department, there are going to be natural ways of accumulating employees and putting them together, grouping them together. So for instance, all of the employees that work in area B in the company, they would start at maybe 6:30, 6:25 in the morning. And then another group of employees that would work in area C, they would stagger and they would come in at 10 minutes later at 6:35. So you're automatically creating a natural breaking point. So it becomes an exercise of a large administrative control. So you're basically doing it by, I think, by process area makes the most sense.
Great, thank you. I believe the next question was for Carmen. If you can kind of clarify some language for clients and employees. Should employees that have already had COVID be using masks, and why?
Okay, yes, everyone in the workplace should be using face coverings. And the reason is because we still have to maintain that physical distancing, but we have to wear face coverings because we could still get sick and we could get other people sick. We're talking about asymptomatic individuals as well. So yes, you have to wear the face coverings.
Okay, I believe the next one's for Dan. Can you give your thoughts about employees and clients believe that they are not transmitters if they have already had the vaccine or COVID? So I think that's kind of along the same lines.
Yeah, I think we're not seeing a lot of second cases of somebody getting COVID, but you know, we have heard of them. So I think we definitely still just want to take the precautions and, you know, wear the masks, be careful, and just in case. But can you repeat the question again?
Can you give your thoughts about employees and clients who believe that they are not transmitters if they've had the vaccine or COVID?
Yeah, that's one of the issues is our regulation does not address anything with the vaccine yet. So right now, the regulations are very black and white with, you know, if you're in the workplace and you're within 6 feet of a person, you know, if you're not, if there's other people around, you're going to need to wear the mask. I think we might get some clarification as the vaccine comes out, where we're going to see less use of face coverings, but we're not at that point yet. So I expect something to come out on our website, and watch for it probably within the next 2 or 3 months as more and more people get vaccinated.
So along those lines, who do you see being excluded from wearing masks? Are there any specific health issues that would exclude someone?
Well, we have the exclusion already for certain health conditions, but I could see eventually, as the science comes out and as more and more people are vaccinated, that we'll see a relaxation of the face covering requirement. But you know, I can't speculate on when that will be or what will happen, because we're not at that point yet. And then we need to get our guidance from our headquarters, because it's right now it's in the regulation that says they're required at all times. So something's going to have to change within the regulation or a governor's executive order that will allow us to no longer enforce that. So it's just going to have to wait and see, unfortunately.
Okay, and someone said, I would like clarification from Cal OSHA regarding making employees whole on their pay when they need to be quarantined.
Oh, the pay issue. First off, I don't remember if Carmen mentioned this. We're being sued over this regulation. And part of the lawsuit is one that they said they're claiming it wasn't an emergency, so this regulation wasn't justified. Part of the lawsuit is also that we're addressing wage issues that's out of Cal OSHA's jurisdiction. And this is something new to Cal OSHA. So we have, even within Cal OSHA, we have a lot of questions on the pay. But on our frequently asked questions page, it does talk about the pay, and it's dependent on whether the employee is able and available to work. The employee must continue to provide pay and benefits. The issue is a lot of the pay, the sources of getting the funding at the federal level to pay employees to stay home when they're sick expired December 31st. And that has been a big issue. So right now, I think what we're seeing is you could have employees use sick, if they're provided sick leave, they can use sick time to supplement their pay. For people that, and other leave time, for people that are not able to work, they can file like a state disability and workers' comp. But we haven't gotten a lot of guidance yet on how to supplement it to get back to 100%. And we're hoping, again, unfortunately, because it's a new regulation, we're waiting for some additional clarification. And when that happens, it'll be on our FAQ page. So we don't have all the answers right now.
Right.
Okay, and last question. In the future, do you see that an employer will require or be able to require an employee to get vaccinated?
Again, that's a good question. I've seen a lot of articles in the newspaper. I've been reading in the news about articles about whether the mandating of vaccines. I don't know how that's going to work in Cal OSHA, with Cal OSHA, because I know for other regulations, for our bloodborne pathogen regulation that requires a hepatitis B vaccine series be made available to employees, and employees have a right to refuse it. I don't know what's going to happen with this vaccine. And we're still waiting to hear from lawyers. I've heard of some companies say they're going to require it. I've heard other companies just, they're not sure yet. Again, we're going to have to wait and see if we get an answer. Unfortunately, like I said, we don't have answers to all of these questions yet. Our regulation has nothing in it about the vaccines, and I think it's going to be more of a employment law type issue, whether something like a vaccine, which is an invasive procedure, can be made mandatory.
Great, thank you. So that is all the time that we have for our questions. I want to remind everybody that you will be getting a follow-up email with contact information, so you can contact the presenters directly, and a copy of the recording, so you will be able to go back and see the slides and any information that you might have missed or want to rehear. So I'm going to turn it back over to Bobby.
Thank you so much. And thank you to Jessica and to all the presenters. Great information. On behalf of the Chamber of Commerce, we thank you for being in business, for investing your resources and creating jobs to help rebuild our economy. If we can ever be of any assistance, please outreach to us. I would like to publicly just say to Linda, thank you for your years of service to us. She leaves us this Friday to go into the entrepreneurial spirit with her husband. We wish her all the best of luck. God bless you all. Have a wonderful day. Thank you.
Thank you, everyone.